जय जी, आपका वीडियो बंद कीजिए। जय जी, वीडियो बंद कीजिए। वो वीडियो के ऊपर क्या, इसे लेफ्ट साइड में वीडियो का आइकॉन है, उस पर क्लिक कीजिए। आपके लेफ्ट साइड में वीडियो का आइकॉन है, वहां क्लिक कीजिए। लेफ्ट साइड में देखिए। लेफ्ट साइड में वीडियो का आइकॉन है, वहां क्लिक कीजिए। हाँ, ओके। वेलकम। एम आई ऑडिबल? एम आई ऑडिबल? एम आई विजिबल? क्या मैं मेरी आवाज आप तक आती है? ओके, ओके। एम आई विजिबल? एम आई विजिबल? ओके, थैंक यू। सुस्वागतम। You are heartily welcome to my TCM सहस्पंदन TCM एकेडमी। आप सभी का मेरे सहस्पंदन TCM एकेडमी में हार्दिक स्वागत है। गुड इवनिंग। मैं विवेक राणे। आई एम विवेक राणे, practicing acupuncture from 35 years, vast experience in this field, treated many patients and conducting classes all over India and all over world। शायद मैं बहुत इजी इंग्लिश बोल रहा हूँ। मुझे आशा है आप सभी को समझ में आए। तो ये हमारा सेकंड सेशन है। तो acupuncture on acute pain and acute emergencies। acupuncture on acute pain and acute emergencies. So when any condition is there acute, whether it is pain or whether it is any emergency. So there are the specific point on our body which are working. They stop the pain and they heal the acute emergencies. So let us discuss one by one by every point. So let us talk about the individual secret point. हम हर एक दिन secret point के पर बात करेंगे. So LU6 LU6. So this is the maximum opening located on the radial palmar aspect of the forearm. This is the radial side of the forearm. And this is the palmar side. Palmar side. This is the palmar side and this is the dorsal side. So this point is located on the radial side and the palmar aspect of the forearm, underlying joining LU5 to LU9. LU5 on the cubital foot. This is the LU5 at the elbow, center of the elbow, and LU9. So when you are connecting to LU5 to LU9, you draw a line, LU5, LU9. So 7 tune above the transverse crease. This is the transverse crease. 7 tune above the transverse crease of the wrist. It is the 7 tune above the LU9 line joining on LU9 to LU5. So this is the exact location. You can see the image here. So this is the Ziclet point of the lung meridian. Ziclet point is that work on the acute pain and acute emergencies. So what is the acute emergencies in case of lung? There is a sudden asthmatic attack. So it is the acute emergency. So when you reach this point, immediately the acute emergencies, that acute asthma will be come down. Okay, this Ziclet point of the lung meridian, so it's descend and regulate lung chi. Lung chi always descend to communicate to the kidney. Okay, so this point of the lung meridian descend and regulate lung chi. Stop bleeding. और जो रक्तस्राव होता है वो रोक देता है. Stop bleeding. Clear heat. Okay, this point, if there is the heat in the body, this point clear it. And how you can needle? Needle perpendicularly insertion. So no oblique, no horizontal. It is perpendicular. Perpendicular insertion 0.5 to 1 tune. So, okay, this is the 1 tune. This is the thumb breath. This is the 1 tune. You prick the needle. It in this measurement, okay, or half tune in the kids, in case of kids, okay, break the half tune, and in case of adult, break the 1 tune. Okay, this point is used to clear heat from the lung and to stop bleeding. It also benefits the fluid of the lung by removing heat. This point is often used in case where there is swelling of the throat, tonsils, or upper respiratory tract due to infection such as the bronchitis or pneumonia. So, what is the uses of this point? This is a This point is moisten the lungs. If there is the dryness in the lung, so this point is moisten in the lung. Clear heat can help foot pain. This point stop bleeding. This point treat acute cough, wheezing, or asthma. And dissemination and descent lung chi. At this point, treat contraction of the 5 fingers. If there is a contraction of the some patients come and he told doctor, you can treat my fingers which are the contract. See, that patient cannot open these fingers freely. Okay, there is the stiffness, there is the spasm in the fingers. Okay, so you can treat. Your answer will be yes, I can treat this your condition and apply the LU6 in this case. And this point also clear the pathogenic wind, heat, or wind dry. So if you learn the TCM, that is how to diagnose it. So this is my course. It is the pre-recorded course. So you can come to know so what is the pathogenic wind heat and what is the pathogenic wind dry. Now, what are the consequences of this energy? Okay, so this point also clear the pathogenic wind heat or wind dry. So traditionally, the point is always used in case of where lung heat has led to coughing of blood. If there is a coughing of blood, खांसते खांसते अगर ब्लड आता है, खांसते खांसते कपिंग में अगर ब्लड आता है, तो दिस पॉइंट इज वर्क. This is the very important to stop the coughing blood. So interestingly, this point is also sometimes used for headache. It is because of deficiency when there is a reduced absorption of the oxygen due to compromised lung function. So if there is the lung deficiency and oxygen level is come down, okay, so this point is work in that condition. And also if there is the oxygen come down, patient will be suffer headache. So if some patients come to you, you should see his oxygen level also. So these patients often have headache included by सब कफ बहुत खांसी रहेगी. ऐसे कंडीशन में अगर हेडेक रहता है तो दिस पॉइंट इज आल्सो समटाइम यूज्ड for hemorrhoid as it can clear it from the large intestine. अगर पाइल्स में it is a bleeding piles, अगर bleeding piles है तो भी ये पॉइंट्स काम करता है. It is because of bleeding piles का से it is a function of the dysfunctioning in the large intestine. So lung is the pair of organ of the large intestine. Lung and large intestine are the pair organ. Okay, understood? Is it clear? Okay, this is a large intestine K1. Okay, cingulate point of the large intestine meridian. Large intestine meridian का ये cingulate point है. So with elbow flex, when you bend, slightly bend the elbow, the point is on the dorsal radial side. This is the dorsal outsider. This is the dorsal radial side of the forearm on the line connecting Li5 to Li11. So this is the Li5. See in the picture, it's the Li5 and Li11. So draw the line here. Li5 is on the that is the lateral end of the crease. Okay, Li5, lateral end of the crease. It is on the wrist, lateral side of the wrist. Okay, so it is the anatomical snub box and Li11. Okay, this is the lateral end of the elbow crease. Let's connect this line and Li5 to Li11, and this point Li7, it is the thigh tune proximal. Li5 से आगे 5 tune. This is the 3 tune. 4 finger is the 3 tune and 3 finger is the 2 tune. This is the 7 tune away. 7 fingers आगे ये point है. LI11 के डायरेक्शन में। तो ये उसका लोकेशन है। दिस cingulate point of the large intestine meridian clear, heat and detoxify and expel wind. It benefits the throat. It benefits the throat. And how you can needle? Needle perpendicular insertion, half tune to 1 tune. It is thumb breath, half tune to 1 tune. So this point is used to clear heat. ये heat clear करने के लिए हम यूज कर सकते हैं and regulate the stomach and the intestine. So most commonly it is used for painful disorder of the hair, including toothache, headache, nosebleed, and inflammation of the nasal cavities. Also, facial paralysis and trigeminal neuralgia. Okay, these are the uses of this point. These are the indications of this point. LI7. This LI7 also sometimes used for the occasional pain in the abdomen upon large intestine and sudden onset abdominal pain with the diarrhea. Then let us discuss the uses once again. So uses are abdominal pain, headache, and barbarism. पेट में आवाज आता है, इंटेस्टाइनल साउंड, पेट में आवाज आता है, barbarism, and sore throat, throat pain, sore throat. Now, our next point is the ST34. See how to locate the ST34. When knee is flexed, knee को थोड़ा सा bend कीजिए. When knee is flexed on the anterior part of the thighs, on the line connecting the anterior superior iliac spine. This is on the lumbar area, iliac spine, and the lower lateral border of the patella. Okay, 2 tune above the patella. This point is the 2 tune. See, 2 thumb breath, 2 thumb breath on the lateral edge of the patella. जो अपना जो घुटना है, उसका जो घुटना का हड्डी है, उसको पटेला बोलते हैं. वो पटेला से 2 finger breath, 2 thumb breath. So this is the this is the 2 chun, or take this 3 fingers. Okay. So this is the upper border of the patella. See, upper border, upper lateral border of the, this is the lateral side and this is the medial side. So take the lateral side and count the 2 chun on the straight line. This is the ST34. Okay. See, cingulate point of the stomach meridian harmonize the stomach and subdue rebellious chi. So what is the rebellious chi? So rebellious chi means chi का उल्टा बहना, contract, contradiction. Okay, chi का उल्टा बहना. It is the rebellious chi. So this point, ST34 of the stomach meridian, harmonize the stomach and subdue the rebellious chi. जो chi उल्टा बह रही है उसको सीधा कर. ये point. Activate meridian. This point activate meridian. Stop pain on the meridian pathway. If there is the pain on the stomach meridian pathway, so this point stop pain and relieve acute condition on the pathway or the stomach. It is the stomach anywhere, any problem. Okay. So this point you can needle perpendicularly and insertion should be half chun to 1 chun. Half chun to 1 chun. This point is used very often for stomach pain. अगर पेट में दर्द है तो ये पॉइंट हमेशा यूज करता है. ये पॉइंट लेना ही है स्टमक दर्द के लिए. उसके साथ और भी पॉइंट है तो हम अलग से उसका डिस्कस करेंगे. So this point is used very often for stomach pain and spasm. It is also used for acute swelling in and around the breast. So stomach meridian is passing through the breast. So in case of acute swelling in and around the breast and for swelling of the knees in both of the case, in this point used in treating the branch of the disease, the roots should be carefully separated to prevent return of condition. So let us summarize. Let us summarize the uses of stomach 36. It is used for the mastitis. It is the inflammation of the breast or any swelling of the breast in on or around. So it is very useful for acute stomach pain and it is useful for vomiting and belching. If there is vomiting, it is a or vomiting and belching is the rebellious chi. Stomach chi should be flow to from up to down. If there is a belching or vomiting, the stomach chi flowing down to up. So there is the vomiting and belching. So this one stops vomiting and belching. And also work on the nape. Nape. There are the other points also for knee pain. It is the most powerful point for the knee pain is the pericardium 6. Okay. Let's discuss the spleen 8. Let's discuss the spleen 8. Spleen 8. What is the location? On the medial part of the lower leg. Medial means inner side. Inner side part of the lower leg, 3 chun below, 3 chun below from the spleen 9. This is the spleen 9. You can see in the picture. This is the yellow dot is the spleen 9. And this spleen 8 is the 3 chun below from the spleen 9 on the line connecting to the tip of the medial malleolus. ये जो घोटा है मतलब पैरों का घोटा है तो उसको spleen 9 to tip of the medial malleolus. तो ये लाइन में ये SP 8 point है. It is the 3 chun, 4 finger below the spleen 9. So this zigzag point of the spleen meridian harmonize the spleen, regulate menstruation. This point regulate menstruation and the uterus, moves blood. This point is have capability to move the blood and regulate the chi. If blood moves, then chi also can be regulated because chi and blood are flowing together. So needling perpendicularly and insertion 1 to 2 chun. 1 to 2 chun insertion. This point is used primarily प्राथमिक से ये point in the treatment of lower abdomen pain. If there is the lower abdomen pain, there most always this include dysmenorrhea. Dysmenorrhea, it is the painful menstruation. Dysmenorrhea with the sore cramping pain. The treatment of the bladder pain is also appropriate for this point. Spleen 8 is also used to reduce swelling in the lower limb. Okay, why this is swelling? So because of swelling is always because of dampness. So spleen, if there is the spleen deficiency, there will be damage, and this point, this cingulate point is working on this condition. And again, uses of the this point. So this point used for the diarrhea. Okay, diarrhea. It is the diarrhea is often caused by the spleen rebellious chi. This one also used for the abdominal pain. This one is used for the dysmenorrhea, that is the painful menstruation. This one is used for the menses cramp, and this one is used for the irregular menstruation, irregular menses, SP8. Now, our next point is heart 6. Very important. So, included on the palmar part of the forearm. This is the incipient point, incipient point, and it is on the palmar side of the forearm. The point is on radial side. This is of the tendon. So you feel the tendon. This feel the tendon on the heart meridian, and this is the go to the radial side of the tendon. Okay. This point is on the radial side of the tendon muscles, flex or carpi ulnaris, and half tune above the transfer piece of the wrist. So this is the transfer piece of the wrist. It is a half tune above, half tune above. It is half tune above the heart 7. So heart 7 is on the transfer piece. It is a half tune above from the heart 7. This secret point of the heart meridian comes the same clear deficiency. Heat, clear this point, clear deficiency, clear heat, nourish heart, healing also, stop night sweating. If there is a night sweating, apply this point. So heart 6 is very good point for steaming bone. If the sweating in the bone, steaming bone disorder, and night sweating. So needling in this point, perpendicular insertion, 0.3 to 0.5 joule, 0.3 to 0.5 joule, only little insertion. So this point is used to clear heat from the deficiency and to stabilize the spirit. This point has kind of harsh action that both restrain and calm. Clinically, these involve symptoms pattern that include stiffness and discomfort in the chest, so palpitation and mild agitation or disconnected speech with an underlying pathodynamic of the patients. So this is not an excess type mania. This is a pathodynamic deficiency. So this is not an excess type of mania or agitation. In addition, the point is often used in the protective chi disorder, including either excess sweating or the inability to sweat. किसी को पसीना नहीं आता है तो भी ये पॉइंट्स काम करेगा. अगर किसी को एक्सेस पसीना आता है, बहुत पसीना आता है, तो भी ये पॉइंट्स काम करेगा. Uses of this point: see, nosebleed. If there is the word in the allopathy, that is the epitaxis. Epitaxis. Nosebleed. Night sweating. किसी को रात को सोते सोते ही अगर पसीना आ रहा है तो भी एक पॉइंट्स काम करता है. कार्डियक पेन, हार्ट का अगर दर्द, हृदय शूल एंड हिस्टेरिया, पागलपन एंड वॉइस लूज. अगर आपका आवाज कम होते होते जाता है, आवाज अगर कम होता है तो भी ये पॉइंट्स काम करेगा. अगर सामने वाला बात कर रहा है, अब आपको बहुत नजीक से सुनना पड़ रहा है, तो उसको ये पॉइंट लगाओ, उसका आवाज बढ़ जाएगा. Next point, our next point is the small intestine 6. Our next point is the small intestine 6. See this, small intestine 6. On the radial dorsal ulnar part of the forearm. This is the radial dorsal and this is the ulnar part of the forearm. This is the ulnar part, ulnar side. This ulnar side, this is the radial side. And this is the dorsal part. This is the palmar and this is the dorsal. This is the dorsal part of the forearm in the depression on the radial side of the stellar process of the ulna. So you should know the bones and muscles name and the tendons names, okay, when you are learning the acupuncture. So this circulate point of the small intestine meridian activate the meridian, benefits the eyes. What is the, understand the uses of this point. So this circulate point of the small intestine meridian activate the meridian benefits the eyes, benefits the shoulder and arm, and alleviate pain. पेन को कम करता है. ओके, उसके और शोल्डर पेन के लिए और आर्म पेन के लिए भी ये यूजफुल है. आइज का भी प्रॉब्लम को सॉल्व करता है. इट्स बेनिफिट्स इन द आई, and this activate the meridian, small intestine meridian is activate. And needling to this point, needling oblique insertion toward the elbow, oblique insertion toward the elbow. Okay, and insertion should be half joule to 0.8 joule. Okay, it is the less than 1 joule. This point is used to clear the head and brighten the eye. आंखों में रोशनी तेज करने के लिए ये पॉइंट आप यूज कर सकते हो. So brighten the eye. It can create acute neck or lumbar pain. If there is the acute neck pain, बहुत तेज neck pain है या lumbar pain है, तो you can use this point. For the eyes, this involves case where older people begin to develop nearsightedness. नजीक का अगर नजीक का दृष्टि दोष है, नजीक का दृष्टि दोष है ओल्डर पीपल में, तो ये पॉइंट काम करता है. तो once again I am showing you exercise 6. This is the exercise 6. Say this. So this is the ulnar side of the wrist on the dorsal side, and this depression, you will feel the depression when you semiflex your arm. Who can locate this point? Who can locate this point? Do you locate it? Exercise 6. Type on chat box. Okay, exercise 6. Locate location. You can understand. Okay, Indraji, very good. Exercise 6. Now let us move to bladder 63. This is the bladder 63. Okay, bladder 63. This see the red spot, bladder 63. Okay, on the lateral part of the foot. This is the lateral part of the foot. Directly below the anterior border of the external malleolus. So this is the external malleolus, and see the anterior border. Anterior border. So it is the directly below the anterior border of the external malleolus, lateral to the lower border of the cuboid bone. So this is the cuboid bone. You can feel this your cuboid bone. This is the lateral border of the cuboid bone. Okay. So feel the depression there. And this giblet point of the urinary bladder relax the sinews. If there is the spasm, if there is the tension, it is the stiffness in the sinews. So this point relax the sinews, calm the mind, and activates the meridian and elevate the pain. Needling, how you can needle? Needle perpendicular insertion 0.03 to 0.5 pull. This point clear orifice and reduce pain by unblocking channel circulation. Okay, if it clears the orifice and reduce the pain by unblocking channel circulation, it is often used for the acute lumbar pain because this point, this meridian traveling on the back. That is there is the two pathway. One pathway is the 1.5 chun away from the spine, and second pathway is the 3 chun away from the spine. So so understand the importance of this point. This point can be very useful for the lumbar pain, acute lumbar pain. And this point is also useful for occipital headache and to reduce intensity of epileptic seizure. If in any kids or any person they are suffering with the epileptic seizure 4 times, 5 times, 10 times in a day. So when you prick this point, so this point will be reduce the intensity of the epileptic seizure. So when you are practicing in your clinic, so bladder 63 is also used for hyperactive disorder of the person or any kids, that is the ADD and ADHD, that is the adolescent disease. ADD is the adolescent disease, and ADHD is the attention deficit hyperactive disorder. In this case, this point can be very useful. You rarely listen this type of indications of this point. So uses of this point. So UB63, this is the Ziegler point used for the leg pain and motor impairment, any neurological problems, that is the motor impairment. So this point also used for the low back pain. This point also used for the infantile convulsion. It is an epileptic attack, epileptic seizure. This point also used for the epilepsy and also used for the mania. This point is also used for the mania. So in recent in 100 years, this point has been favorite for use in acupuncture anesthesia. So UB63 is using in acupuncture anesthesia, especially in cranial surgery, cranial brain surgery. This scan is used, there is a very precise needling technique to perform the acupuncture anesthesia for the cranial surgery. So consequently, it is often used, often chosen for the patient with the head pain that feels if it the deep within the bones of the head. Sometimes patient feels that head pain is within the deep in the head, in the bone, the skull. Now, kidney pie. This point on the middle aspect of the foot, middle part of the posterior and inferior to the medial malleus. This is the posterior side and inferior side of the, this is the medial malleus. One tune directly below from the kidney tree. You locate first kidney tree. It is the tip of the malleus and the Achilles tendon, and take a midpoint in between. This is the kidney tree. And come down one chun, come down. So this is the kidney high. In the depression of the medial side of the tuberosity of calcaneum. This is the calcaneum area. Okay, understood this location? This cingulate point of the kidney meridian regulate menstruation. This point regulate menstruation, benefit urination. If there is the frequent urination, if there is the blockage of the urination, so this is very useful for that problem. So how to needle? Perpendicular, perpendicular, 90 degree. And insertion should be zero point 0.3 to 0.5 joule. So this point is always used for pain in the lower abdomen, especially in case of painful urination due to urinary tract infection. If there is a urinary tract infection and urination is painful, directly use this point. Then cystitis, bladder spasm, and kidney stone. This point can also be used for painful or delayed menstruation. If there is the painful menstruation or menstruation is not getting time, it is the delayed menstruation, you can use this point. Especially in case where the point is also tender. If there is the delayed menstruation, and one more very important use of this point, kidney pie. This point is used for the kidney stone pain. If there is the acute kidney stone pain, patient cannot bear that pain. So take the lancet, the lancet needle, and prick this point and pass to blood, 20 to 30 drop blood from this point. Immediately pain will be stopped and patient will be go to sleep. So use of this point, it is used for the uterus prolapse. If there is the uterus prolapse, it is other factors also, spleen, cheese sinking, along with this point, kidney pie. You can manage the uterus prolapse. So also difficult urination and amenorrhea, painful menstruation, and blurred vision. It is also useful for blurred vision. In eyes, not only understand the liver control eye, okay, liver open to eyes, but also kidneys role is important. If there is a not enough moisturizing the eyes, so there is the dryness and there will be blurred vision. So kidney eye can be used for the blurred vision. Okay. Our next point is the Our next point is the pericardium 7. Next point is the pericardium 4, not 7, pericardium 4. So see the point. So it is the 5 June proximal from the pericardium 7 on the transverse crease of the elbow. That is the middle area. So on the palmar part of the forearm, 5 June above the transverse crease. This is the transverse crease of the wrist on the line connecting pericardium 3 on the elbow and pericardium 7. So this is the giclette point of the pericardium 7. Sorry, pericardium meridian. This is the giclette point of the pericardium meridian. This pulls the blood. These points blood को ठंडा करता है. Move the blood. Blood को आगे बढ़ाता है. Remove blood stagnation. Blood की रुकावट को क्लियर करता है. हाँ, blood को आगे बढ़ाता है. It's move the blood. It's remove blood stagnation and it calm the shame. अपना जो शेन है, अपना जो शांति बढ़ाते हैं, अपने माइंड में शांति बढ़ाते हैं. Calm the shame. And how to needle this point? Perpendicular insertion, half tune to 1 tune. This point is needle half tune to 1 tune. Okay. This very useful point. This point is very useful. Is used to clear the nutritive level of heat and stop bleeding. It nutritive level in the any organ. So nutritive chi is flow in the organ, internal organ. Any internal organ heat and this stop bleeding. This point also has the ability to calm the spirit. It is used clinically for variety of conditions involve the organs of the upper abdomen and chest, especially those that are involved bleeding. Uses anxiety, coughing blood, nosebleed, epilepsy, cardiac pain, palpitation in the chest, and vomiting blood. This pericardium 4 can be used in variety of issues. So clinical examples including clapping, coughing, vomiting, or spitting blood, and nosebleed to be appropriate for this condition. They should also involve heat in the nutritive level. Other symptoms of nutritive level heat that always respond to treatment with the pericardium pore include inflammation of the mesenteric linings of the upper burner. For example, pleuritis, that is the inflammation of the lung, pleurisy, and other, it is the pericarditis. Pericarditis. It is the inflammation of the pericardium. In this case, this point can be used, pericardium pore. Inflammation of the mammary gland. This point freeze and unblock the flow of blood in the upper burner. And this does also appropriate for the variety of condition involving blockage of the coronary arteries, especially when heat is present. Here, it will be helpful to pause and know the difference among the three cleft points of the arm in channels. So, while it is relatively easy to conceptualize LU6, so along with the LU6, pericardium 4, LU6, pericardium 4, and heart 6. These are the three giglet points of the upper in organs. As a point that is used for the pain in the chest and the lung with coughing of the blood. So, how does one differentiate the pericardium and the heart cleft point? Pericardium and heart cleft point. How you can differentiate? So, pericardium is more useful for problem with the flow in the coronary arteries. This is very more useful. Pericardium pore is more useful for the problem with the flow in the coronary arteries. A more substantial problem in the blood of the heart. If the problem in the blood and the coronary arteries, blood flow in the coronary arteries, if they are problematic, use this one, pericardium pore. By contrast, heart 6 is more often used for night sweat. If there is the night sweat, use heart 6. The problem always because by deficiency of heart blood. If there is the deficiency of heart blood, why there is a heart blood? Because mother is not supplying the heart blood to the heart. Who is the mother? Liver is the mother of the heart. If mother itself is deficient, how can supply the chi and the heart to the chi and the blood to the heart? So this this problem, it is a night sweat. If patients come to you to complaining, doctor, I'm suffering from the sweating in the night. So focus on the heart blood deficiency and heart chi deficiency. The deficiency of heart blood that lead to night sweat can be thought of involving blockage in the channel, causing problem with the chi transformation of the and heart is always involved more in the function of the heartbeat and blood movement, while the pericardium is more always associated with problem in the physical muscles and blood supply of the heart organ. Okay, this was about the pericardium 4. So let us discuss about the liver 6. Liver 6. So what is the how you can locate the location? How you can locate the liver 6? The middle part of the lower leg. Okay, this is the middle part of the lower leg and go 7 tune above the tip of the malleolus on the middle of the medial part of the tibia. This is the tibia bone. So see the tibia, that is the medial part of the tibia. And on the from the tip of the medial malleolus, locate the tip of the medial malleolus and go upward and 7 tune. Okay, it is on the posterior border of the middle of the tibia. 7 tune above the tip of the malleolus and posterior border of the tibia. See, okay, location is clear. This ciclet point of liver regulate liver chi. This point regulate liver chi, relieve pain, resolve dampness, and how to needle? Subcutaneous insertion. Okay, subcutaneous insertion, not deeply, subcutaneous. It is the parallel to skin. Okay, subcutaneous insertion, half tune to 0.8 tune. Okay, this point is used to clear heat and regulate chi. Related symptoms include hypochondriac pain. there is the hypochondriac pain and abdominal distension. कुछ भी खाया, कुछ भी खाया, पेट थोड़ा सा भी खाया तो भी पेट भरा भरा हुआ है. It is this symptoms is the abdominal distension. This type of chi level heat is often associated with the recovery from acute hepatitis. Other chi level heat condition that can be addressed with this point include. So, what are the uses? Uses liver 6 through prolonged lochia and diarrhea, hernia pain, rib pain, abnormal uterine bleeding, and pain during intercourse. Pain during intercourse. This can be used for these symptoms, these indications. And tonsillitis, abdominal infection, and inflammation in the joint. If there is a joint inflammation, abdominal infection, and tonsillitis, in this case, this point can be useful. It is also always used in treating premenstrual syndrome, PMS. Australia always used in treating premenstrual syndromes and dysmenorrhea of the type where the patient feels abdominal discomfort after the period has finished. Period finish होने के बाद भी अगर abdominal discomfort पेशेंट को लगता है तो ये पॉइंट काम करेगा. Liver 6. All of these symptoms involve compromise of the liver function of directing the flow of blood. When enough blood flow is not maintained, heat can be developed by unblocking the flow of channel of chi. With this declared point, this function of the organ is stimulated. Again, to note the difference among the three cleft points of the channel of leg, channel of the leg. 3 points are used to treat pain in the abdomen, both spleen 8 and kidney 5, along with the liver 6. So this point treat pain in the lower abdomen. Spleen 8 treat menstrual pain due to a relatively excessive stagnation of the chi and blood while kidney 5. Similarly, treat excess type stagnation in the kidney or bladder, and it is in the always stones, kidney 5. So especially I told you about the stone, kidney stone pain, LU5, bleed the, because it is the excess step stagnation. By contrast, the effect on the G dynamic that arise stimulating liver 6 is caused to affect the middle burner and the blood distribution in general. So, for all 3 points, the movement of the channel chi that appear from the stimulating the cingulate point serve to clear stagnation and heat. Okay, now let us discuss the urinary bladder 59. This is the urinary bladder 59. So on the posterior part of the lower leg, behind the external malleolus, this is the behind the external malleolus, and 3 tube directly above the UB60. This yellow dot is the UB60, and go through 3 tube above directly on the straight line, 4 finger. So this is the location of the bladder 59, UB59. So this deflate point of the young Chow vessel, extraordinary vessels, so activate the meridian. This activate the meridian, benefits the low back and legs to reduce the pain, and how it needle perpendicular and insertion 0.8 to 1.23. This cingulate point of the young Chow vessels is most often used to clear the head. It's clear the head. Clinically, this always involve pattern involving headache, dizziness, chakkar aata hai. Also because of the association of the Chow vessels with the coordination of muscle movement. The point is used for trigeminal neuralgia and problem with the movement of the muscular culture of the face, such as the Bell's palsy. So again, we can see the image. So uses the lower leg pain and motor movement and lower back pain and heavy head, feeling heaviness in the head and the headache. This point can be used. Bladder 65. Sorry, bladder 35. UB 35. So UB35 on the lateral part of the lower leg, 7 above the tip of the external malleolus, on the posterior border of the fibula. This is the fibula, is a posterior border of the fibula, and GB 35. 7 directly above the tip of the malleolus, tip of the lateral malleolus. So this deflect point of the yang wave vessels activate the meridian, relax the sinus, and relieve pain. So how you can needle? Perpendicular, and insertion should be 1 to 1.52. This split point of the yang wave vessels is always used to clarify consciousness in case where the yang circulation is failing to reach the head. Consequently, traditional indication for this point always include mania and withdrawal, as might be expected. The point also benefits circulation in the liver and gallbladder, and it does always seen in case of the hypochondriac and chest pain. See this point. This is the perfect location of the point. So you will get this PPT. You can study. Now, kidney 9. Kidney 9. Kidney 9 on the medial part of the leg. This is the medial part of the lower leg. Thigh tune directly above the kidney 3. This is the thigh tune above the kidney 3. On the line connecting kidney 3 to kidney 10. Kidney 10 is the on the medial aspect of the back side of the knee. Okay. At the medial and inferior end of the belly of the muscle, the gastrocnemius. Okay. This point is the split point of the inward vessel constitution, clears and heat in the heart, elevate pain, and needling perpendicular. Insertion should be 1 to 1.52. So one interesting use of this point is in-way split point. One very interesting use that is not commonly listed is for clearing the deep-seated toxic flame, because that is the in-way is associated with the coordinating the provision of nourishment in the internal environment. One may therefore consider toxic accumulation such as the tremors or tumor anywhere in the body, tumor or tremors to involve blockage in airway function. A few clinical experience indicate that using strong scaring moxa at this point, so strong moxibustion at this point may create a kind of immune response which stimulate the body's anti-tumor resistance. So it's also used for the this is used for the beautiful baby point. So if pregnant woman wish her baby should be beautiful, so use this point. And anxiety, this point is used for the anxiety. This point used for the manic depression. Okay. Now our last point is the kidney aid. Kidney aid. This is also the Ziegler point. On the medial aspect of the lower leg, two chun directly above from the kidney tree. This is the kidney tree. Go two chun, three finger directly above from the kidney tree. So half chun anterior to the kidney 7. This is the anterior front side, half chun above the anterior above the kidney 7. Posterior to the medial border of the tibia. This is the medial border of the tibia. So connect this tibial bone. Okay. So look at this tibia and this border. Okay. So this circulate point of the in-chow vessel. This is the kidney 8 is the circulate point of the in-chow vessels, regulate rain and chow meridians. This point regulate menstruation and how to needle perpendicular insertion and 0.6 to 1.2 chun. So the in-chow circulate point is always used for the emotional disharmony which can involve discomfort in the abdominal cavity. So let us remember that the in-chow vessels has the function of the coordinating multiple channel internal muscle movement. So kidney helps regulate the musculature around the internal organ and therefore calm patients who have feeling of disquiet. They are not quiet. That is the associate with the sense of the organic discomfort. That is the organic discomfort. So uses of this point, So painful menstruation, that is the pain and swelling of the testes. Pain and swelling of the testes. And uterus prolapse, diarrhea, constipation, and irregular menstruation. Okay. So notice how how close kidney 8 to the spleen 6. Spleen 6 and kidney 8 is the very close. So another point always used to discomfort of the organs, in particular the organs of the lower abdomen. Okay. Okay. 1 minute. तो देवेंद्र जी, मैंने आपको अनम्यूट किया, बोलिए।
सर लीवर 6 के बाद कोई भी स्क्रीन शेयर नहीं हुई, सब स्क्रीन ब्लैक थी, सभी मैसेज दे रहे थे सर आपको। लीवर 6 लास्ट स्क्रीन थी, उसके बाद में कुछ भी नजर नहीं आया सर, ब्लैक स्क्रीन रही। वो सारा आपको रिवीजन करना पड़ेगा।
ठीक है, मैं आपको उसका पीपीटी सेंड करता हूँ, आप पीपीटी से लोकेशन देखिए।
हाँ थैंक यू सर, वो सभी मैसेज कर रहे थे लेकिन वो आपने पढ़ा नहीं। लीवर
तो ठीक है,
6 लास्ट।
हाँ, पीपीटी पीपीटी सेंड करता हूँ।
ओके सर।
हाँ, पीपीटी से आप उसका रिलेट कीजिए।
थैंक यू सर।
हाँ हाँ। तो कुछ कोई बात नहीं है, या ऐसे टेक्निकल प्रॉब्लम होते रहते हैं।
हाँ हाँ हाँ, वो तभी तभी सर सभी कर रहे थे, लेकिन आप उसमें बिजी थे ना, आपको नहीं पता नहीं चल सका।
हाँ हाँ हाँ।
लीवर 6 लास्ट वन था।
हाँ ठीक है, आप ये सब पीपीटी में सब कुछ है।
ओके थैंक यू सर, थैंक यू।
हाँ ठीक है। एनी अदर क्वेरीज? एनी अदर क्वेरीज? और किसी को कुछ पूछना है क्या?
सर कल भी क्लास हुई थी, कल तो लिंक नहीं मिला कोई हमें।
नहीं नहीं, कल नहीं हुई थी।
अच्छा अच्छा ठीक है सर, कल भी होगी सर।
अभी मैं अनाउंस करूंगा। कल क्या प्रोग्राम है, नहीं 2-3 दिन में वापस ले लूंगा। इसके जो जिक्लेट पॉइंट के 4 पार्ट है, अभी सेकंड पार्ट हो गया।
लेकिन वो फर्स्ट पार्ट कर सर, उसका फिर पता नहीं चला हमें, फर्स्ट पार्ट कब हो।
फर्स्ट पार्ट का मैंने ग्रुप में और उसका रिकॉर्डिंग दे दी है ना।
अच्छा अच्छा सर, थैंक यू सर, वो देख लेंगे
हाँ,
सर।
फर्स्ट पार्ट का रिकॉर्डिंग दे दी है मैंने।
हाँ वो देख लेंगे सर, देख लेंगे।
हाँ हाँ। ओके, थैंक यू वेरी
ओके।
मच। लेट अस मीट अगेन in other session, free session.